I'm going to be performing an insertion of a catheter on a female. So before I do so, I'm going to check the patient's records and check the order for the catheter insertion, and I'm going to then perform hand hygiene. Once I come into the room, I'm going to introduce myself to the patient, let her know what I'm going to be performing, and then also let her know that I'm going to close the curtain for privacy purposes. Then I'm going to ask her if she has any allergies to latex or iodine, which in this case, she is allergic to iodine, so that'll be good for the future to know. I have raised the bed as well as put the rail down so that I'll be able to access the area. And I have lifted her legs up in a position to where I'll be able to access the area and insert the catheter. So I'm just going to hold back her gown. And to start, I'm going to clean the perineal area. So I'll just put on gloves. And I will clean it with a washcloth with warm water, warm soapy water, or I can use wipes too, just making sure that they're warm. When I clean, I'm going to do it in a downwards motion, and with every downwards motion, I'm going to fold the wipe in so that it's being cleaned with a new area of the rag. Once I do that, I can dispose of that and dispose of my gloves and perform hand hygiene. Once I perform hand hygiene, then I'll get out my kit. I'll make sure that it is sealed, which it's sealed, and I'm going to start to set it up. So I'll take the kit out of the box. And I will place it on the bed, and then slowly open it up, making sure that I don't touch any of the inside part of it. Once I do that, then I will take my sterile gloves, and I will put my sterile gloves on. Okay, and once I have my sterile gloves on, I can throw this also in the trash. Then I will take this drape, and I'm going to place the drape under the patient. Like so. After that, I'm not going to need this drape, but I will take this blue drape, and I can touch any part of the drape because it is all sterile and my hands are still sterile. And I will place that down. Okay, once I do so, then I can get everything prepared. So the patient is allergic to the iodine, so I can throw this out. And I can take the top part of the kit, I can kind of separate that. And so what I'm going to do is I'm going to open up the hydrogen peroxide, hypothetically, pour it over the cotton balls, and I'll be able to throw this out. I will then take the lubricant as well, and I will open that up, and I will pour it onto my tray here so that I can be able to lubricate the catheter. Once I'm done with that, I can throw that away. I will set up my catheter. So I would put the syringe on the catheter so that I'll have that all ready to go once I get that inserted. And the first thing I'm going to do is lubricate the end of the catheter. And then I'm going to lubricate the about 2 inches And once I do that, I'll just place it here on the tray for when I'm ready. I'll then take these little forceps, grab the cotton balls that do have hydrogen peroxide. I'm just gonna clean off the area again. So with one cotton ball, I'm gonna use my non-dominant hand to open it up so I can clean the right side of the labia. Once I do that, throw that cotton ball out, take another cotton ball, do the left side, and then one more, and I will do the center. And I'm going to keep that hand opening the area up, and then I'll take my catheter. I'll make sure that I'll lubricate it again just to make sure that it's on there about 2 inches. I'm going to let the patient know that she should feel some pressure with the insertion of the catheter, and I'm going to insert the catheter about 2 inches until I see that urine has started to fill. Once I do that, I can insert it for about 2 more inches. And once that is inserted, I'll take my sterile hand and I'll squeeze all of the solution, the water, into the balloon to inflate it. Once it's all the way in there, I'll take that same sterile hand to pull at it to make sure that it's not going to come out. After that, I can tape the catheter onto the patient's leg. We don't have access right now to the tape, but I would tape that up onto there, and I would remove this part of the bag, and then get rid of all of my sterile supplies because I do not need that anymore. So I can throw all of this in the trash. And both of my gloves are non-sterile, but that's okay. I can remove my gloves. Then I'll perform hand hygiene. I can take the catheter and attach it to the bottom of the bed. And again, this would be attached if I were to have taped it. I will raise the side rail up and lower the bed. I would have covered her up again, lower her legs back down. After that, I will perform hand hygiene again once I leave the room, and I will take off any PPE that I had put on.